In this video, we are talking about neuropathy. Neuropathy, burning, tingling, numbness, pins and needles, right? Sharp nerve pain. And in my opinion, one of the most poorly diagnosed and poorly managed medical conditions we have. And so in this video, I want to show you why it's one of the most poorly managed conditions and the potential functional approach that your doctor is likely neglecting. But first, a little background. Who am I and why should you care? My name is Lori Clark. I'm a nurse practitioner and I've been in the medical community for over a decade. I've treated thousands of patients, and this functional approach works if you just do the roadmap, the simple map, right? This approach has helped thousands and thousands of people, and it's used in many of the functional medicine places across the country, right? So neuropathy is my passion. Listen, my mother-in-law suffered from neuropathy. She lost her ability to drive. What if you lose your ability to walk because you can't feel your feet? It's horrible. And all the other conditions that happen as a side effect of that. It's, because people are neglecting getting to the root problem. So that is why I'm very, very passionate about it. When you see people suffer in agony and no one's even trying to get to the root cause of it, it just frustrates me. So that is my why behind why neuropathy is very passionate to me. Okay. Look at this. So what happens when you go to the doctor with this complaint, this ailment, right? You give them the classic symptoms and they give you some chemical cover-up and say, come back in 6 weeks and see me, right? Look at the side effects of these chemical compounds. Let's get a pen here. And 3 of them, you have dizziness, dizziness, dizziness. So common sense. If I can't feel my feet and I'm gonna take a medicine that's gonna make me dizzy, that is just probably setting me up for a bad outcome. And that is not something that I'm willing to risk. I just don't think that's a good approach, and it makes no sense to me. So I want to get into the weeds just a little bit. I'm not trying to take up too much of your time. I'm just really trying to explain to you what's going on here. So I want to talk to you about our cells in our body. And in order to find the root cause of the problem, we need to get down to the cellular level, because that is what our body is made up of trillions of cells. That's actually held together by the fascia. So we need to look at all these different components. We need to look at the fascia. Why are our cells going from healthy to dysfunctional to disease, right? Let's find the root. Is it the foods that you're eating? Is it the toxins that you're exposed to causing the inflammation that's damaging the cell? Something is clogging it up. But look at the healthy cell right here. Okay, this healthy cell is, you see all these little prongs, right? These are receptor sites. And this is how your cell communicates. It communicates, they're semi-permeable, which means that you want to get the waste out of the cell and you want to get the oxygen and the nutrients in the cell. So we teach intentional breathing because we get rid of 70% of our toxins through breathing. So breath work, using our diaphragm and not just the regular sympathetic, just, breathe. Okay, we want to breathe deep to help get oxygen into our cells. But if our cells are damaged and they're dysfunctional, see how these receptor sites, they're bent, they're broken, they're missing, and you see that red? That's inflammation. So inflammation, do you think this cell's going to work properly? And then what happens when it just keeps getting more broke because we're not fixing the root cause? Well, it gets diseased, and that's when you get your diagnosis, maybe that's when you have your diabetes which a lot of times neuropathy and diabetes go hand in hand, right? So we know that it's a circulatory problem. So why not start talking about using opening up your lymph system and, doing things to get your feet moving and doing other things to really work with your fascia and find the root causes through testing and find out what is going on. We test, we don't guess. We want to repair ourselves. So here's the good news. We have the healthy cell, we have the dysfunctional cell, and we have the disease cell. So wherever you're at, know that God made us wonderfully, right? This does not have to be permanent. We can work towards a great solution, find the root cause, and get you back to the most optimal level that you can be. Because our body likes to maintain homeostasis. Our body is resilient. If we give it what it needs, nutrients, a lot of times with neuropathy, there's just simple vitamin B, vitamin B12, and other missing nutrients, that are contributing to this. Okay, so we look at all the global picture, all right, and we fix it that way. And that is why we get such great results. And that is why people keep coming to us. And they've come to us, being on so many different medications, and they're not getting any better. And they're fed up, they're tired, and they want help. And so that's what we're here to do. But this is just an example of insulin. I've got the insulin here. And this is why people are insulin resistant, because if your cell is diseased, it can't communicate, right? It can't get insulin in. And so just running rampant. And when you have the disease like this, you go to your doctor, they might just keep increasing your medication. Why? Because these receptor sites, they're like your ears. They can't hear. So they keep giving medicine and try to give louder and louder and louder to communicate with the cell. So let's either heal the cell so it can be healthy, or, we call it phagocytosis, which kind of just gets rid of your diseased cell so it's not clogging up your system. Okay. And there's a way to do it. And we have a simple roadmap. And I like to use the analogy of, I don't think I have any more slides for you, but I use the analogy of, I'm on a road trip from California to Florida, and I don't have a map. So how successful do you think I'm going to be, right? Am I going to get lost? Am I going to get frustrated? And I'm going to lose my way? But with the roadmap for functional medicine, with the natural approach, it's you can get to where you're trying to go. So that's what we're here to do. So listen, if you are frustrated, if you're having problems and you're looking for solutions, there's somewhere around here, there is a link, and you can get on a discovery call with me. I can ask you questions, you can ask me questions, and we can see if you're a right fit. Now, if you're having neuropathy problems because of a mechanical problem, like you have a bulged disc or you have stenosis in your back, I would hold off on calling me. I would go ahead and get in touch with a chiropractor or physical therapy and work it out that way, because you know that there's a mechanical issue causing your neuropathy, right? But if you are fed up with the system, you're fed up with everything, and you're really looking for the root cause, then I'm absolutely happy to talk to you. I would love to talk to you. I just have two things I ask. If you want to take 20 minutes out of my day to talk to me, please show up, right? We run a very busy practice. We help a lot of people with a lot of different ailments. And we just ask if you carve out your 20 minutes and I carve out my 20 minutes at the same time, right? And the other thing is, you got to be ready for change. If you're not ready for change, then this is not for you, because you have to be dedicated. Because I'm going to tell you, it works, right? It's got over a 90% success rate. If you follow the system, you follow the simple blueprint, then, there's great outcomes here. So I'm excited. Hopefully you'll be getting in touch with me and we can help you evolve yourself on this journey. And so I appreciate your time. Thank you for watching our video.